Okay. Looks like a little bit ago we didn't have many people, but now we're starting to see people in the waiting room. So give it a minute here. One more drink. All right, Jeff, what do you think? Ready to go? Okay. Admitting people.
Welcome, everybody. Now is a great time to check your audio and video settings. If you find yourself having some technical difficulties, please send the meeting hosts a private message and we can address it. All right. Let's get started. My name is Jeff Javier, and I'm with the University of Arizona Sonoran Center for Excellence in Disabilities. I'm going to go over the community guidelines one last time. So here we go. Number one, please assume good faith from your colleagues. We are all here to learn together. Two, please use the chat or raise hand function if you wish to share. Participants are not permitted to unmute themselves. To share verbally, you will be called on after virtually raising your hand. Three, please recognize and respect others' feelings, background, and cultural differences. Four, not all questions will be answered during this meeting. Five, be judicious and efficient with shared information and experiences. If you are speaking, try to limit yourself to 30 seconds or less. It can be just as courageous to listen as it is to share. So please do your best to understand when it's time to step back instead of stepping up. Six, if you are speaking, please speak slowly as there is an English captioner and ASL interpreters working diligently. This is true for meeting presenters as well as participants. And finally, for a certificate of attendance, we have a survey that if you complete, we'll give you that certificate as soon as you finish it. So, and more information about that will come at the end again. And so without further ado, I'm going to hand it off to Natalie Luna Rose.
Hey, thank you, Jeff. And again, thank you for joining us this afternoon for our last session of the 11th Annual African American Conference on Disabilities. My name is Natalie Luna Rose, Outreach and Communications Manager for the Arizona Center for Disability Law. I see in the chat, some of you have probably joined us from the beginning of this month when we first started our sessions. So if this is your first session, thank you for joining us. If you've been here the whole time or have joined us a couple sessions, thank you again. And if you want to put in the chat where you're from, we kind of like to keep track. We've had some really exciting places people have joined us, including Egypt, Canada, Nairobi, New Zealand. So we've become international. So again, thank you for joining us this afternoon. I want to thank our sponsors before we move on to today's final speaker. And if you give me just a moment to indulge, and thanking our sponsors for allowing us to get this conference off the ground. Without their support, we could not do this month-long conference for you all. So thank you so much to our gold sponsor, Perkins Coie, our silver sponsors, Arizona Department of Health Services, Children and Youth with Special Health Care Needs, and Valley Toilet Dealers, our bronze sponsor, Ability 360, our advocate sponsors, Arizona Statewide Independent Living Council, Arizona State University, Arizona Developmental Disabilities Planning Council, Arizona Commission for the Deaf and Hard of Hearing, Arizona Community Foundation, Banner University Health Plans, Diversability Incorporated, Lexus Superstition Springs, National Disability Rights Network, Marks the Spot Barbershop, NAACP Maricopa County Branch, Raising Special Kids, and Unique Multicultural Connections. And a special thank you to our co-host again this year, Arizona Center for African American Resources, the University of Arizona Sonoran Center for Excellence in Disabilities, and Northern Arizona University Institute for Human Development. Without Jeff and John's help, I could not be doing this because they're part of our logistics team, and I wanted to give a special shout out to them because I could not do everything. And thank you so much, gentlemen. Now to our speaker. So today's session, moving from safe spaces to brave spaces, Mr. Derek Willis, he's the director of the University of Iowa's Center for Excellence in Developmental Disabilities at the Center for Disabilities and Development within the University of Iowa Healthcare. And I know we have a lot of people from Iowa today joining us, so thank you for that. So Mr. Willis, I'm going to hand that over to you.
Thank you, Natalie. And thank you all for being here as well. I'm a middle-aged African-American male, brown skin, bald-headed with a graying beard, I would say. I'm wearing glasses, a white shirt, and I have a blurred background. I go by the pronouns of he, him, his. And before I begin, I just want to say it's a pleasure to be here before you today and to help close out an amazing session that the Arizona Center for Disability Law has put on. So much honor to be a part of this prestigious conference. It's been something that's been on my list, and I've been interested in participating and attending, and I never have had the opportunity to do it. Now I'm closing it out. So I'm, again, deeply honored. Want to give a shout out to J.C. Farkas with the Arizona USAD that invited me to participate and to talk about brave spaces, a topic that I think is very timely for what we're experiencing in today's time. But before I go there, I just want to do a couple of things. I was able to catch a couple of sessions. I love the work of Dr. Morgan and her work with Sankofa. I was very impressed with Dr. Dawson and Dr. Holt, who talked about adverse childhood experiences and the work of trauma as it relates and how it impacts individuals' lives. I saw Dr. Pravathan with the U.S. Access Board. So I say all that to say that this has been an amazing conference, and kudos to all those who were on the planning committee that made this happen. Just a little bit about myself. I serve, as they said, I was USAID director. Prior to that work, I ran a urban impact center at the University of Missouri in Kansas City, worked with neighborhoods and communities of color, focusing on issues related to health, education, employment, housing, all those things that kind of are discussed when you talk about the social determinants of health. And so I have 18 years in this network. Currently serve on the board of directors for AACD. I previously chaired AACD's Multicultural Council, co-chaired that with JC. And then also, I think what's important to recognize is that I give my time. I serve on many local boards, local councils, local committees, and just a little information to give you a little bit about my background. And so I said this topic is relevant and is very timely. I know that what this country has experienced over the past several years with civil unrest and the pandemic and how it adversely impacted people of color, particularly African Americans, issues related to identity, oppression, power, privilege, all emerged in the forefront. And I think to have a conference that is specific to African Americans on disabilities and other topics that impact African Americans is so powerful. And so I'm so grateful for you guys. But if I began to look at this concept of brave spaces because as a result of all of the civil unrest and a lot of the issues that I previously mentioned, I find myself being asked to serve on a number of committees, being asked to lead listening sessions, being asked to serve on boards, focusing on diversity, equity, and inclusion, and task forces. And so it was just, at times it was overwhelming, but at the same time, I saw it as an opportunity that doesn't come often. And it was an opportunity for us to advance issues related to equity, diversity, and all of these topics that have a profound effect on the quality of life of many people. And so I found that even though that I was exhausted and oftentimes frustrated, and a lot of times in the middle of conversations where, I felt like there was more that we should be doing and more that we could be doing. And a lot of people began to talk about these safe spaces and creating a safe environment. And I think as a result of that, many of the conversations that we had, were comfortable conversations. And so I began to think about what is the next phase? What is this next level? And I got introduced to this concept of brave spaces. So if you Google brave spaces, safe spaces, brave spaces, you'll see a ton of stuff that's out there. But there's a gentleman named John Palfrey. He has a book that speaks to it. It talks about moving from safe spaces to brave spaces. If you Google the term again around bravery, you'll see Brene Brown at the University of Houston and all of her work that's around bravery. But what I put together today is just some thoughts related to our area of focus in terms of health outcomes and outcomes for people with disabilities. And also just some thoughts in terms of looking at, this whole concept of safe spaces and brave spaces. And so you can advance the next slide. So today, what I would like to do is just kind of identify some key public health services, define and deconstruct safe spaces, and really kind of help you understand. And it's not no knock against safe spaces, because I think that's necessary. And even in brave spaces, we still want people to feel safe. But I argue that it's going to take more than just a safe space for us to get the provocative, thought-provoking, deep conversations that are necessary to bring about true change. And if one remains comfortable, in my mind, you're probably not growing. I think of an athlete, and when I played sports, if I was comfortable, I probably wasn't pushing myself hard enough. And if I'm not pushing myself hard enough, I'm not going to grow as an athlete, and so that the term comfort and the term safe kind of works against what we're wanting to do in terms of growing and bring about true change. And then I was just going to discuss some best practices as it relates to DEI conversations. And so I'm going to start with, next slide. I'm going to start with just some essential public health services that really kind of lay the framework why I think this conversation is so relevant today. In 2020, the Centers for Disease Control and Prevention released and revised these EPHSs, these essential public health services. And they've been doing this for the past 25 years. And it's a well-recognized framework that begins to look at health and look at outcomes as it relates to health and how can they have an impact that keeps people safe, keeps people healthy, and keeps our country healthy and safe as well. And so they created these essential public health services. And and revised in 2020. It was a collaborative effort with the Public Health National Center for Innovation and the Beaumont Foundation and a number of individuals that convened, public health experts and leaders from all across the country to begin to think about if we're going to deliver a service, what are those essential services that are necessary? And they identified 10 essential things, but I just pulled out 4 of them because I believe that they're relevant to the conversation that we're having today around brave spaces. And all of it is related to connecting to communities of color. And so the number one thing that you have to do is effectively communicate to educate people. You have to strengthen and support, mobilize communities. You have to build and support a diverse public health workforce. You have to build and maintain strong organizational structures and infrastructures. You can go to the next slide. And so communicating effectively, what does that require? It requires actively engaging in two-way communication, developing and deploying culturally and linguistic appropriate and relative communications. Is taking all of those things in consideration. And the only way that you're going to be effective in this is that you have discussions, you have conversations, and you have authentic, thought-provoking, and conversations that could possibly leverage some discomfort. Next slide, please. Mobilizing communities. How do you begin to address the issues of communities of color without convening and facilitating, number one, multi-sector partners which serve these communities, which have knowledge of these communities, which have respect from these communities, which have the ability to bring folks together. In order to mobilize it requires fostering and building these genuine strength-based relationships where you're creating environments where people are not looked upon as the problem, but also but creating these environments where you're pulling out the strength and the good things about these communities and having those conversations, and then authentically engaging with community members. And so it's It's going to those communities, it's having those conversations, it's not hosting the meetings in your facilities and asking people to come to you. And so mobilizing communities is a necessary and it's essential public health service that has to happen in order for us to be effective in bringing about true change in the communities of color. Next slide, please. The workforce, looking at leadership. How do you create pathways? I used to call these pipelines, and a colleague of mine introduced pathways to me, and I love it, because when I think of pipelines, and you hear about these conversations, pipelines to prison and pipeline, it's just more one directional. But when I think about pathways, I think about where you can go many different directions. And so how do we build pathways? And you'll see a lot of universities and colleges that have programs for undergraduate students that help them understand health practitioner pathways and introduce them to the different fields. And they have them for kids that are in high school. I used to know a program called Summer Scholars that I had a daughter that went to one of these pathway programs, and they got to have the white labs, coats, and visit pharmacy and medicine and nursing and dentistry to just open their eyes to different opportunities. And then how do you create opportunities where you not only have people in these pathways, but you have them in leadership positions all over the area. All of this requires conversation, requires engagement, requires trust. And go to the next slide, please. And so what we have learned and what we've heard and what we have experienced over the past couple of years, particularly during times of civil unrest, with all that happened with Black Lives Matters and George Floyd and this sense of awakening, so to speak. What we found was that people were wanting to engage in conversations. People were wanting to have discussions, and the first thing that people would say was like, what we have to do is we have to create these spaces that these conversations can have, but we have to make sure that they're safe. And when you think about, safety, Merriam and Webster's online dictionary defines it as free from harm or risk, affording safety or security from danger, or difficulty or risk, creating environments that are comfortable, and creating environments that help people, feel like that they won't be attacked. That's the concept of safe spaces. And to go back a little bit on safe spaces, the term kind of started in the 60s when there were places for LGBT communities, LGBTQ communities, places for people to go to that were people that were like them, places that they can go where they feel safe, wouldn't be attacked. And so this concept of safe spaces has a historical context as well. Next slide, please. But as we participate in these conversations, you begin to ask yourself, is safety gonna get us to the point where we want to go in terms of advancing, having those difficult conversations, having those uncomfortable conversations, and really getting us to the point where we have this authentic learning. And what we've learned is that profound feelings of discomfort, they're incongruent with the idea of safety. And then authentic learning, usually requires this risk. It requires difficulty. It requires deep conversations. And a lot of times through these listening sessions that I participated in, I heard stories that just tore at my heartstrings, and people talking about what they experienced on their jobs, what they experienced from their supervisors, what they experienced in the communities that they worked in, communities that they come from. And so even when you try to create these spaces that are safe, so to speak, you are going to hear these stories of pain. You are going to hear these stories of struggle as well. And so as we began talking about this, I began to think about, what does safety actually offer? Next slide, please. And what we found out was that we cannot foster these critical dialogues in safe spaces. When you give the opportunity and you ask the difficult questions and you talk about the things that people experience, some people are going to feel like they are being attacked if you have a diverse group of folks there. Some people are going to feel like it's not safe to even speak on what they're experiencing. And so I began to ask myself, what is safe? Are we safe anywhere? Most people think of safety in their homes. And we've seen time after time that that's not always the case. And we can't even guarantee it in our home. I'm thinking of a story of Amir Locke in Minneapolis just a couple of weeks ago. Was just his life was taken through an experience with law enforcement when they did a no-knock policy and came into his house and frightened him in the middle of the night. And so even in your house, there are times where we don't feel safe. Are we safe on our streets? Are we safe in our communities? Are we safe at work? It's the concept to me. I don't even know if we can even have safe spaces. And so I began to think about why was the conversations that we have, and why were, in many of them, so many people who were quiet, so many people who didn't say anything, so many people who had the opportunity to begin to express, what they were experiencing, express, ways to bring about change, never left that comfort zone and was obsessed with this identity or the ideology of a safe place. And so I offer to you that what I would like and what I think is more effective is that it is critical that we move out of this comfort zone and we begin to move into this concept of brave space. And I want to touch on brave space again. Just slide to the next slide, please. So brave spaces, it's a concept that's been around for quite some time, and other people talk about what it means. And so this one's from Boostrom. In 1998, he said, learning necessarily involves not merely risk, but also the pain of giving up a former condition in favor of a new one. And so in order to be brave, it is actually taking that risk. You'll see that you hear the concepts that are also called courageous conversations, that is very similar to brave spaces, where they talk about, just a strategy to develop, a strategy developed specifically to encourage taking risk. And so So when you talk about safety, it's risk-free. When you talk about brave spaces, when you talk about courageous conversations, it's encouraging you to take these risks. And it emphasizes the need for that courage and the bravery rather than this illusion that we've never been able to actually provide, just as an illusion of safety. So what is brave spaces? So to me, brave space is a productive dialogue where participants are encouraged to speak honestly and critical from their own experiences. And I think it's important that when you have these conversations that you do have a diverse group of people, because I think there are times where affinity groups are necessary, and I am a believer in that. But I also think in order for us to really bring about true change, you have to begin to engage in dialogues with people who maybe might not know anything about the way you see the world and the lens that you look at the world from. Organizers of brave spaces, they try to facilitate dialogue in a way that steers away from harm, but it also acknowledges the likelihood that people will feel uncomfortable. And so it's not about, totally throwing out the safety component of it, but it's also acknowledging that there are, and there probably will be, things that you hear, things that you experience that will cause some discomfort, and acknowledging that, safety at some point in time might be not possible to keep. Brave spaces, I think, again, makes room for the fact that we all have different understandings of the world and the way in which it operates. In brave spaces, we agree to hold each other accountable when we make mistakes. And we hope dialogue will take and lead us to knowledge that we couldn't get alone. In a sense, this brave spaces is encouraging you to take risk. It's encouraging you to lean into that discomfort. And it's not guaranteeing safety. It's not guaranteeing that during these conversations that you won't hear something that might be harmful to you. And it's encouraging people to express their true thoughts, their authentic thoughts, and sometimes expressing those, it might not be in agreement with all the people that are at the table. And so these brave spaces, it's just a space that you encourage people to remove that comfort, that sense of comfort, that sense of safety, and to take risk. Because we have learned, and what I've learned through my experiences in all these conversations, is that we don't take these risks, we don't instill bravery in these discussions, then we're going to remain in the status quo. We're going to continue to stay where we are. And in fact, staying where we are is not safe. And so being safe is harmful in these conversations as well. So,
Derek,
yes.
there is a question in the chat. Would you like me to read it before
Sure.
we move on? Okay. Are you familiar with the concept of Are you familiar with the concept of psychological safety in the workplace? And if so, how do you see that intersecting or comparing to creating brave spaces, at least within the workplace context?
Great question. Yes, and psychological safety in a workplace is necessary. And so I think that what we have to do when we have these conversations is that you have to begin to lay a framework and lay some ground rules that protects that psychological safety and protects people from that type of level of harm. And so I'll go to the next slide where I'll touch on this a little bit, and that's where you kind of begin to think about how do you actualize a brave space, and really where it comes from is through skilled facilitators. I can't advocate enough for that, and that key role of individuals to have to lead these conversations. Skilled in the fact that you have the ability to assess the room, you have the ability to see who is quiet and understand if that quietness is because of their thinking and their growing and their learning. Is it because of a discomfort? All of that. And so actualizing a brave space really requires trained facilitators to lead some of these conversations. And of course, setting up ground rules, setting up, ways in which the group will operate that offer this sense of protection, but also lends itself to you having deep thought-provoking conversations and really kind of giving you the opportunity to grow as a group and stuff. The other thing that you do in actualizing brave spaces is you revisit all of those ground rules, because sometimes once you set them and you begin to have dialogue, people will think of different things that need to be added or things that need to be revised. And so a good facilitator will always go back and revisit, revise, and that's a constant process throughout the brave space. And actualizing a brave space is really kind of paying attention to the group, the movement of the group, or the lack of movement of the group, and revisiting things that you laid out as ground rules, reminding people of those ground rules when you come together as groups, really setting the tempo for what those conversations will be like. And then you strive for these protracted dialogue and defining brave space. And so giving that group the opportunity to define what does a brave space mean to me, and spending a significant amount of time on it. A lot of times when you pull people together, they're so quick to jump to the topic or to the issue that they want to address, that they don't take the time to really, number one, build the group, build the team, build trust, build a sense of just a sense of safety among the group, because they rush to the topic. And so what is necessary is to really take your time in defining what that brave space is and giving people the opportunity to do that.
Derek, there's another comment in the chat, if you don't mind.
Sure.
In my opinion, and not only mine, one of the biggest problems with safe spaces isn't that people are afraid to make others uncomfortable by expressing their true opinions. It's that it's literally unsafe, not just psychologically, but also the risk of future retaliation to challenge a privileged perspective.
Absolutely. Absolutely. That's what we found in a lot of our, we had listening sessions. I work at the University of Iowa hospitals and clinics, and when all of the civil unrest came about with George Floyd and all the activity that was going on with Black Lives Matters and the marching and all of that, our hospital leadership made a decision to host these listening sessions. And during that time, we did have people who actually were brave enough to participate, but also were definitely afraid to speak truth. We had to create this environment where people felt like that their words and the things that they said were going to stay in this room, but also be taken consideration by leadership to bring about true change. And a lot of them were talked about the fear of retaliation and am I going to lose my job and those things. And so you're right on point that a lot of times, it is that fear that prevents people from going there. And so again, you have to create a lot of time and you have to spend a lot of time on helping people, number one, trust you and you have to demonstrate that you're true to your word, and that takes time and it takes place. So for me, it's very difficult to begin to have those conversations without going through a process of where you're laying ground rules, you're beginning to learn each other, to beginning to grow and trust with each other as a group, and then demonstrating to them that their word, that their thoughts are valued, and it's important, and trying to create this environment to let them know that we can't move forward without your input, without your authentic dialogue, and without your true feelings in certain situations. And so, so that's where I think in actualizing the brave spaces, it really takes that time and the opportunity to really set up those ground rules. I also say set up brave space agreements, and those could be things like listen to understand and not to respond. A lot of times when someone's talking, we feel like there's a need to respond. It's also around setting up something like address the idea and not the person that is presenting that idea. Another brave space agreement, letting folks know that there's no ideas too far out there. No idea is a dumb idea. An idea and a thought needs to be expressed. It's also having regular check-ins, like I said, not only with revisiting and revising the rules, but just having check-ins with the people who are part of the group and just saying, hey, I want to take a pause. I want to check in with everybody. I want to see how people are feeling. I want to see what are there things that we could be doing better. I want to see if there's some things that we need to revise, having those regular check-ins. And it's also never being afraid to sit back a while, sit back and think, and lean into that level of discomfort. It's only at those times, in those states of ambiguity, that I think that you'll find some of the greatest answers to some of the situations that we're in. And so encouraging people to lean into that level of discomfort as well. Just going to go through a few ground rules that and just kind of dissect some of those a little bit. So next slide, please. A lot of times when you have in these groups, people will say, well, sometimes it's necessary for you to just agree to disagree. I would encourage you, because when I think about agree to disagree, I think about people saying, well, I don't agree with that. I'm not going to listen to, what they have to say because I'm already set in my way and I'm not going to agree with that, but I can disagree with that. So two people then walk away having two separate opinions and they just agree to disagree. It doesn't really move the needle forward. So it's easy to retreat from conflict and avoid discomfort when you agree to disagree. We're not trying to go to that level. So we're trying to create an alternative rule that inspires courage in the face of that conflict. And then how do you explore concepts of controversy with civility? How do you look at different viewpoints and explore those in these types of phrases? And so to me, throwing out things like agree to disagree in your ground rules, which is something that has, historically been a part most of the time, most parts of these ground rules. Another ground rule, next slide, is related to respect. Again, I don't think it requires, it is not a controversial thing. Most people, when you say just respect, we want to respect each other. Most people go to their mind and what respect is to them, but that doesn't mean that their level of respect is what the person who says that they want to be respected is. And so it's important to spend more time discussing what respect is for the group, increasing that mindfulness of different ways to demonstrate respect, and so it's like, I feel respected when, when do you feel respect? When you say respect, what do you mean by respect? How are ways in which we disrespect you? And what are the ways that you want to be respected? And so diving deeper into a conversation, into something like this, again, helps you lay that framework for that brave conversation, for that brave discussion. Next slide, please. And then I just had a few things that, I think are best practices from these conversations, and just wanted to point out a few. What I've learned through these conversations is that, it's very important that you actively seek out the array of viewpoints, and you actively seek out the thoughts of people. And so part of it is when you're having these conversations, when you're inviting people, making sure that it is a broad, diverse mix of individuals that participate in these conversations. I also am cognizant of the fact that as a leader, I have the ability to call a meeting. I have the ability to influence in ways that others don't. And so recognizing that, just like what was said in the question, that privilege matters, and creating an environment where people have the ability to express themselves, and do it in a manner that we try to level the playing field, so to speak. It's very difficult, and I do know that privilege matters. I do know that when I set the agenda and say, hey, I think I want to have discussions related to diversity, equity, inclusion, me as a leader, most people are not gonna say this is something that I don't want to do. And so I know privilege matters, and I think that it's important that you keep that in mind when you're hosting these types of conversations as well. The other thing that I think it's important is that don't be afraid to take a step back. These conversations, these discussions, they're necessary, but they also are part of a journey. And as you know, in most journeys, the road is not always paved out. And sometimes the ways that you go, you'll run into a dead end. And so sometimes you have to take a step back or take a different direction, take a different pathway. And so don't look at that as a failure in these situations, but look at it as a necessary evil, so to speak. But it's also just helps you understand that all of it is not going to go smooth. and don't be afraid to take a pause during these situations and take a step back. And as I spoken to before, leaning into that discomfort, leaning into those difficult conversations, leaning into the space where everybody is not safe, and learning from those discomfort situations, but also trying to identify the ultimate outcome that you want to get, where you have civility throughout that discomfort, but you also have growth that is a result of that discomfort as well, is necessary.
Eric, I have a few more questions in the chat if you'd like to entertain those.
Sure.
Okay, first one here. Are there techniques to encourage conversations and possible confrontations when risk of retaliation is real? I have a Black African-American clients in Minnesota who have fear of speaking out to care staff and me, a white woman, due to past and present trauma. I don't want to force a conversation and don't have a lot of time to build rapport because I know the fear is unfortunately rational, but I can't even create a safe space as I'm physically representing the offending party.
Wow. Yeah. Well, I think the key thing that you mentioned there was time. And you say you don't have time. Well, and to me, I think it's necessary that you make time. And I don't know your situation. I don't know, the deadlines or the restraints that you have from your organization. But if it is important to you, and is it important that you are successful in this situation, I think that you have to find the time to walk at a pace with those individuals that you're trying to serve. And a lot of times that takes many sessions. They have to see that and have experiences that they feel that they can trust you in that situation, because the trauma has created these environments where a lot of times, when they walk in the door and they see you and if you represent something that they feel like was a part of the trauma that they experienced, then you will not get there. But the only way you're going to change that is that you demonstrate to them that what has happened in the past is not what the direction that I'm trying to go in. And a lot of times that just takes time. You just can't automatically gain respect. Sometimes respect is earned. And so I think time is a major factor there.
And I'll read one more. There's a couple of questions that are somewhat similar. What might be strategies to combat the prioritization of comfort? In other words, as a way to keep peace, quote unquote, systemically marginalized populations are silenced or undermined in other ways in conversations.
I'm gonna ask you to read that one more time.
Okay, what might be strategies to combat the prioritization of comfort?
Okay. Yeah. Combat the prioritization of comfort. I think what I would say is that, laying the framework around what is a brave space and talking about the encouragement of discomfort in these brave space conversations and talking about the necessity of that, the move out of that comfort zone, and how comfort zone kind of represents status quo is important. And so I think having discussions that really kind of help people see and understand the importance of going beyond that is important. And I think it takes time. I think it takes time for you to have discussions. It takes time for you to work through situations. It takes time for you to build that trust and go through things so that people can see that you are sincere and trust. I used to work at the University of Missouri, and the communities that I worked in did not trust the university because from a historical perspective, universities would reach out, engage people in research projects, and when that research project went over, or when that money went over, that they left the communities. And so I found myself in a situation where, when I said I was from the University of Missouri, heads would turn and say, not, I've been through this before. But the only way that I was able to work through that is to continue to be consistent, be persistent, but always never made a promise that I couldn't keep. I always was faithful in what I said that I was going to do. And so I think that's critical when you're trying to build these relationships. And then I just have one more slide, and then we can open it up for questions. And so this is just some of the things that I've learned just from these conversations. Affinity groups are necessary, and I wasn't a big fan of that before, but as we've talked, and as some of the questions have been raised through this presentation, trust is necessary. And some people just simply don't, even though you try to set up that environment, some people just never get to the point where they feel like it's real, because they have experienced so many things in the past that have worked against them. And I say that I think people of color, Muslims, LGBTQs, individuals, they walk in a brave space every day. And sometimes there is a need for just those groups to have discussions, just those affinity groups to be together to bring about that authentic conversation. But I also say it's necessary, but it can't be the end of the conversations. It can't be only in this situation. Ultimately, you have to figure out a way that where these discussions, where these conversations, where this information has to cross over into different groups. And so, although they're necessary, I don't think that they're the end all. You also have to understand that people join for different reasons. There are times where people just want to sit and learn and sit and listen. You create an environment that draws those individuals in. You create an environment that invites them, but at the same time, you can't force people to talk, and you can't force people to be engaged. And so, just understanding that a lot of times people will come to a meeting and participate in a session for multiple reasons as well. Another thing that I learned is that you kind of have to have kind of like the end in mind. And so beginning with the end in mind, it's one of those 7 habits of highly effective people. Because these conversations can go on forever if in fact that you don't have a target, if you don't have something that you're striving for, if you don't have something that you have as a mark, something that is measurable, something that is attainable, something that is relevant, and that has time on it. Some similar to those SMART goals. Specific, measurable, attainable, relevant, and has a time related to it. But you have to begin with the end in mind. When you're hosting these brave conversations, when you're hosting these conversations, know what are you trying to get out of those conversations, and then having the ability to assess and determine, when you feel like you have been successful in that. And if you don't, you'll find that as you host these conversations, your numbers will continue to reduce, and you won't have 318 people on like we have today. And you might have that in the beginning, but then the next one is 218, and the next one is 118, and the next one is 80. And so have the end in mind when you begin to have these kind of conversations as well. So that's what I prepared. I am open to answering questions, and just grateful for all of you who saw this as a topic and saw this as something that you wanted to spend an hour with us on and having this discussion. And again, I'm open to questions. And again, I do want to also lay the groundwork that I am no expert in this. I'm just speaking from my experiences that I have had over the last couple of years, being asked to be a part of, being asked to facilitate, being asked to join. And I still have work that I'm learning in this. I think this is similar to cultural competency. I don't think that we're ever competent in culture. And it's an ongoing process. It's a journey. And we're learning through these. And you know, I'm so grateful that I've been able to have these conversations and learn from these conversations, and you know, grateful that you all again decided that this was something that you wanted to spend your time with today. I'm also, my contact information is on the screen there, and feel free to reach out to me anytime. Always open to having dialogue and discussion related to these areas. So.
Okay, wonderful. Thank you, Derek, for your presentation. I'm going to read a couple of questions in the chat. And then please, if you would like to speak publicly, please use the raise hand function at the bottom of your screen under the reactions button, or you can put it in the chat. So I'm going to start. There are a good couple of comments in there, so thank you for those. I'm going to start with a question from Jordan. Can you give a real life example of an interaction or process that happened in a brave space conversation as a contrast to the types that can happen in safe spaces?
Good question. Let me think. Read the question again.
Yes, I'm sorry. Of course, you caught me coughing there. Can you give a real life example of an interaction or process that happened in a brave space conversation as a contrast to the types that can happen in safe spaces?
Actually, I don't have anything that comes to mind at this time. I'll think about it though. I'll think about that. Let me think about it.
Okay. Fan has a question. They have their hand raised. If you would like to speak. Fan, are you there? Are you still interested in speaking?
Doesn't look like Fan is connected via audio. So if they have a question.
Okay, while they're reconnecting, I'm going to read another question here. I have worked successfully in brave spaces in more personal or issue-oriented circles. In workspaces, my experiences have been brave spaces are rare. Suggestions for authentically working in brave spaces in a professional realm. What are suggestions for mitigating feelings getting hurt when working in brave spaces in a professional environment, as there is not often choice in these relationships? There can be real impact on peer relationships and organizational culture, etc. Yet people need to continue to work together.
Yeah, good question, good thoughts. I think to me, when you have these brave conversations, you know, it is an ongoing development. It's an ongoing process as well. Like I said, I think that when you feel like you're in those situations where you feel like your voice is not heard, where you feel like that, you know, that there's possibility of, you know, harm through the conversations, I think that's when the bravery is necessary, when you begin to talk about and express and ask for that time to discuss I think that's where you go back to the revising, revisiting, and rethinking, what, and having the opportunity to express how you feel in those situations. Employment is always difficult because, like I said, you have this dynamic where, if it is an authentic, group, and you have the right players at the table, you're going to have some that have more privilege than others. And I've been in situations where I felt like my voice was not heard, even though I would say it over and over and over again. But for me, it was never giving up. It's also, and if you feel like it's only coming from one individual or group of individuals, pull them aside and talk to them individually, and not necessarily always having that conversation through that group or during that time as well. Yeah.
Okay, I'm going to read one more question in the chat before we get to raised hands here. What thought strategies do you have for staff members to challenge members of management who do not view this work as important or hold an incorrect belief that they are already doing enough to promote diversity, equity, and inclusion in their workplace?
Wow. I think for me, and I've been in that situation before, so I can totally understand and feel you when you say, there are people who believe that they're doing enough and that nothing else needs to be done. What I would do in that situation, though, I would develop, a coalition. I would try to find individuals who can speak to the same thing that I'm speaking to, and ask them to express themselves just like I express myself. It's not to build a coup or anything, but it's just to amplify voices of others. And so you can do that in a number of ways, just like how we advocate for policy, how you advocate for change, but it's building some momentum, it's building a coalition, it's inviting others to speak on the same issues that you're speaking to, and continue to do that. Also, I would look for those champions within the structure of your organization, even though that leader might not believe that it's necessary. There might be somebody that he respects more. It might be somebody a part of his leadership team that you can relate to better, and have them be the ally that helps you moves those things forward as well. But again, I've been in those situations before. And sometimes it gets to a point where if it's not where you need to be at, you might need to make a decision. Because that's what I did when I kept running on deaf ears and felt like, my voice was not heard. I went someplace where my voice could be heard.
Okay, thank you. And I'm going to read, Fan actually wrote in the chat, I'm a caregiver of a person qualified with a disability. We are unable to obtain eligible services in our location. Can you suggest?
Wow, that's a hard one because I'm not familiar with your organization, but let me just say this. There is USEDS, the organizations that I work at, University Centers for Excellence in Developmental Disabilities, in every state. It's a wonderful network. I think that if I was in your situation, I would begin to do a little research to find out who is what university hosts the USED in my state, and would start there to just begin to ask questions around your issues and seeing who is doing work in those particular areas, and see if they have advice for that. We have a system here called Compass, which is an online information and referral system. If you was in my state, I would have you reach out to our Compass, which helps navigate and help people understand where systems, supports, and services are and everything. But I would start with the you said.
Thank you. And I am now going to call on Skylar. So Skylar, if you'd like to unmute yourself.
So earlier we were talking about building trust. And for me, as a lawyer who represents people who are being discriminated against in the disability field, what helps me to do is, like, when I'm talking to my clients, I will share personal information. I'll, be vulnerable in that way, because if they're talking about what they're going through and how ridiculous, it's like, yeah, it's ridiculous. It's like, I believe it, yeah, I've been there. If they have a service dog, it's like, yeah, I have a service dog. If they're talking about their symptoms, and it's just like, no, I understand. I get this, from my perspective, what I've been to, because I think validation, saying, I get it, I feel you, understand, can be very good. But at the same time, I do not want to tell people who belong to a different oppressed population that I understand what they're going through, because
Absolutely.
my experience isn't the same. I don't want to shift focus. So what's the balance of, I understand, especially if, we get overlap in groups, and the things that are different, because I don't want to shift focus away from them, but I do want to relate and make them feel safe and heard.
Yeah, and I think you're on point when you say I don't live your experiences, and so I think it's okay to say that. Yeah, I don't know the steps that you take in or walk in, but I can sympathize with that because of this. But I never say that I fully understand, because each situation is so unique and each situation is so different. And so I think you're on to I think it's a good strategy to have, to say, yes, I can sympathize with where you are. I have a similar experience, but I don't fully understand yours. And so continuing to have that person express what they feel, what they need, what they're experiencing, and learning from what they're saying is critical in those situations as well.
Oh, there we go. And question from Laurel. Laurel, if you would like to speak. There we go. Oh, put herself back on mute. Laurel, were you still interested?
There we go. I
There
got
we go.
it. I was taking myself off and put myself back on. Thank you for all of the information and the questions. It was wonderful. I think the situation that this puts me in the mind of is having conversations about how we continue in our activism in our space, and someone saying that they've reached a place of barrier, meaning they've reached a place where they don't wish to continue to be held to an expectation or something like that. And they make the comment that their safe space, right, has been breached, or that they feel that a certain amount of aggression is involved in asking for the conversation to continue. And I just wonder if there was any type of thinking or experience that you've had with continuing to try to advance that dialogue, because it's needed. Because once you come to that space, if you're not able to get past it with a conversation that is absolutely respectful, that's absolutely inclusive, then it kind of halts the work that folks are doing. I just want to know if you've had any experience or any thought about how to continue to get everyone past that space in a way that will not continue to be a barrier for them.
Yeah.
Anybody in the scenario, yes.
Yeah, very, very good point. Very good point. And I have been in situations where, things were said and they were so direct, and they were attacking. What I tried to do was to go back to the foundation that we built, the ground rules that we built. And when those things kind of violate those areas, bring the group back to just have the discussion around how can we address this? How can we move forward with this? And it's not trying to avoid those situations too. It's laying it on the table and saying, hey, we're at a point right now where I feel like, what has been said is so disturbing that it has impacted our ability to move forward. And having the group help you work through that, I think, is important. But it also could be a point where, you do get to a point where that it's not possible to move forward with the group that you put together. And so, very, very tough situations. But I tend to lean back on, and that's where I think it's important to lay those groundwork rules in the beginning and to keep revisiting those and to keep going back to those and to keep modifying those that help you prevent you from getting into those real difficult spots like that. But sometimes it's unavoidable. And that's all I have to offer. I mean, these conversations are not easy. And like I said, it's a journey. I'm still learning from them. But I've been in situations where I've said, wow, I'm just, that I wasn't expecting that. And you have to take a step back and you have to think about it. You have to analyze it. It might take you time to just visit with that one individually and just say, hey, this is what I felt when you said that, those kind of things. But it's a process.
Okay, two more here in the chat. Establishing a safe space where some desired participants are undocumented is very difficult and requires vetting participants because there is a very real safety threat to them and their family if you are undocumented.
Mm-hmm. Absolutely. When I worked with communities of color, and particularly communities that had significant populations of undocumented individuals, I used this concept called a cultural broker. One individual who had knowledge of their situation, who had at one time been in their situation, who could advise through those situations. I think it's so important that you develop those relationships with people who are from communities of color, who are credible in those communities of color, who share those similar experiences, and partner with them to help you develop those relationships as well. That cultural broker concept, I think, is so critical in many of these conversations and dialogues as well.
Okay, thank you. And another one here. An activist organization I'm in now is having issues with trying to collectively push past the safe space like barrier. By barrier, I mean this phrase, along with others, seem to be used to slow down or stop conversations that are difficult.
Yeah. So is that a form of a question or a comment?
I think it's kind of both. So
Okay.
However you want to take it.
Say it again.
Okay. Maybe I'll just kind of read the question part here.
Okay. Uh-huh.
An activist organization I'm in now is having issues with trying to collectively push past the safe space like barrier. By barrier, I mean this phrase, along with others, seem to be used to slow down or stop conversations that are difficult. I guess that was more of a comment.
Yeah.
And we do have some more questions. Here we go. How do you, excuse me, how do you engage in these conversations without having people of color forced to educate others?
That is a good question. And in fact, when a lot of times when we were pulling together individuals to have conversations, that's one of the reasons why I said that infinity groups are necessary at times. But what I offered was that it's not only about education, and it's helping people understand experiences that we have as people of color, and not necessarily looking at it as like how to treat me as a Black person, you know, but it's really trying to help them understand differences, trying to help them see the world through a lens that we see it in. But yeah, I had a lot of colleagues that refused to participate in listening sessions and committees and groups and took that mentality that it's not my responsibility to educate white people on how to treat me as a Black person. But I think, you know, when you take that stance, it creates a situation where, you know, I'm not going to say that you can't get change, and I'm not going to say that you can't move forward without these conversations. But I think, to me, in a well-developed, brave space, it facilitates the exchange that is both ways. And so I don't always see it as me teaching them how, but it's also me learning in that situation as well and figuring out how to navigate as we move forward. You know, so it's a tough sell to certain people, but I've always seen it as a way for not only myself, but also others who will come behind me, and the opportunity to help bring about true change. So.
Thank you. We've got just a few more minutes for probably one more question or two at the most. So if anybody else has anything to add, please either use the raise hand function or put it into the chat. This has been a very wonderful way to end the conference, so thank you so much. Is there anything else? Any other questions? And I see a really good dialogue going on in the chat, so thank you so much for that.
Well, again, I want to thank you all for hosting such a wonderful series of learning opportunities, and just can't express enough the gratitude that I have for organizations like yours who put on these particular opportunities for people to grow and learn. So appreciate you all.
All right. And we've got clapping hands, so thank you. Yes. Thank you so much. Derek, thank you so much for your time this afternoon. Thank you, everybody, for engaging with this conversation. I am going to thank our sponsors in the chat. Thank you so much. There is a survey, and I know that my colleague John just put it in. I also put in the chat my email address if you have any questions about the conference. This is our last session. We will be having all conference materials, all 12 sessions on our website, not today, but coming very soon. So we will be letting everybody know that those are up. I want to thank our interpreters, Joshua and Sydney. Thank you so much. And our captioner, Sabrina. Without their work, we cannot get this information to you. So thank you so much. I'm going to pass this to my colleague and founder of the conference, Reynaldo Fowler. Reynaldo, what can I say about him other than not just is he wonderful to work with, but just a real visionary with this conference. So, and I know he doesn't like me saying that, but I'm going to say it anyway publicly. So thank you so much, and I will pass it to Reynaldo.
Thank you, everyone. I hope you enjoyed yourself these last 3 weeks. This conference was co-founded by David Carey and myself, 11 years ago. And we feel it's very important that we continue this conference. I want to announce that we are going to make every effort to meet in person in 2023 in Phoenix. And I hope you're able to join us. If you're interested in maybe being a speaker, please reach out to me and we will consider, we have a committee that will take a look at what your application is. Also, I want you to take away this information that you've heard over the last 3 weeks, take it back to your communities. And the purpose really of this conference is for the African-American community and for those folks who serve the African-American community so we can come to a better understanding on how to meet the needs of African Americans with disabilities in terms of a culturally sensitive manner. And so again, I want to thank you. I want to hold you long, but we really appreciate it. I really would like for you to do the surveys so you can get your certificates of attendance. And we really look forward to seeing you in 2023. And again, I want to thank all of our sponsors. I want to thank the Planning Committee, JC, John, Jeff, and also the Commission for the Deaf and Hard of Hearing, the DD Network in Arizona. We are a great team. I think we're probably the best team in the country, our Arizona DD Network partners. So again, thank you from the 11th Annual African American Conference. Travel safe, and we hope to see you in 2023 in person in Phoenix, Arizona, sometime in February. Have a great day and be safe. Take care.
Thank you, everybody, for attending.
Thank you. Hey, Natalie, do you know the highest number that we had during this time?
We do, and hold on just a moment. Let me stop our live stream here. And my record.